the same thing happened to me, only because I knew you before this happened. We'd had some conversations. When I broke my arm up the way I did, in a lot of third world countries, it would have been an amputation at the elbow. And as I was there in the hospital, they kept on coming in every few hours and asking me what my pain was. And because of you, I started making them flip it around. And the health professionals were almost completely incapable of doing it because of all their prior training.
Right.
But when they would come in, they would say, so what's your pain threshold right now? And I go, well, don't ask me that question like that anymore. Ask me how much I'm feeling now. And they said, no, I need to know what your pain is. I said,
Right.
well,
You know why they need to know it.
Oh, yeah, right. Yeah. And
So
so
they
I
know
said,
how to prescribe it.
look, the scale.
Scale.
Well, and it was kind of funny because they started laughing about it because I kept on insisting. And I said, you can do simple math. We were talking about scale of 1 to 10. If I tell you my comfort is 5, you can put down that my pain is 5. But don't ask me about my pain. Okay, ask me if I'm comfortable. And if I tell you my comfort is 6, then you can say my pain is 4. Let me teach you how to do this.
Right.
Well, it was hilarious. I got to tell you, Lois, it was hilarious.
It had to be. But can I address that for a second?
Yeah.
Okay. Or ask a question, I guess. Was this acute pain? Was it right after it happened? Shortly thereafter, like within 2 weeks or so?
While the ulna and the radius were broken in many, many pieces, it was just a jigsaw puzzle in there. And so this was while in the hospital.
Okay,
and
so
this was acute.
Acute, right.
There was morphine going on and all of that, right? And because the 2-hour operation ended up being 4.5 hours, the plate that they had figured out initially, they had to take it out and put a different one in, and they put 13 screws in, and they threw away pieces that weren't going to fit anywhere anymore. It's like, we don't need that. No, we don't need that either.
But the point being, so our readers aren't passing out there, our listeners aren't passing out. The point being that for acute pain, I kind of get why they say, what's your pain? Because if you've had a hip replaced and they want to know how to script your pain medication, which I strongly encourage you use the first few days after a hip surgery, that medication is there for a reason. But here's my point, Bob. Mm-hmm. If you're going back 3-4 months later, and they say, "Well, Quaz, what's your pain today?" That's when you can pull out both barrels, because by that point you should be focusing on the comfort. What's the comfort level today? If you wake up in the morning and you say, this is killing me today, or my back is killing me, well, you're setting yourself up for pain all day long. Whereas if you wake up and you say, I think my back is a little more flexible than it was a couple weeks ago. Mm-hmm. That's what you're focusing on, is the flexibility.
Well, and when you say things like, my back is killing me, you're also putting in a suggestion into your mind that you're being killed.
Yeah. and it will kill you, let me tell you.
That totally cannot be good. So
no, it kills all the fun in life, that's for sure. So by altering the way that you perceive it. And acute pain is one thing, and we can do all sorts of things hypnotically to immediately reduce that acute pain. But long-term pain is more challenging. It takes a little more time hypnotically to begin to condition yourself to a different way of thinking and strategizing.